I want to talk about face masks being used in the public if you're not having any symptoms. If you're having any symptoms, you obviously shouldn't even be in the public, right? But the three things I want to address real quickly today for you are: number one, that only N95 face masks have of any value. I disagree with that. Number two, that you shouldn't wear face masks because it's taking the amount of supply away from healthcare workers, which we'll talk about. And the third thing is that if you do wear face masks, it only increases your risk of possible infection. So all three things are out there, and let's talk about them. So first, the use of face masks that should be used are only those of the N95. Those are the form-fitting face masks that are often used in the hospital. Prior to COVID, we would need to use them when we're going into rooms of patients with tuberculosis. Basically, yes, those are the best face masks to wear. However, very few people have them. And to say that those are the only face masks that actually work is not correct. So when we wear face masks, we wear them for multiple reasons. But one of the reasons we wear them is so that respiratory drops that are coughed or sneezed in the air, that we don't breathe those in. However, me personally, I don't even have an N95 face mask, and I'm not going to try to get one and take them at this point away from healthcare workers. Thus, I'm going to do whatever I need to do to protect myself from people that are not practicing social distancing, and be able to, if a person were to walk up right in front of me, turn around and sneeze or cough, I don't want to breathe those respiratory droplets in. If those respiratory droplets are breathed in because I did not wear a face mask, then I would feel terrible about it. So just having a normal mask, such as this one right here, would help prevent me from breathing those particles in. The N95 masks are definitely the best for that because they're very form-fitting and they don't allow those respiratory droplets like that of COVID to get into your respiratory system. However, there has been evidence to show that if you don't have an N95, and it's as simple as me going to HEB yesterday, and if a person were to, I would be walking by, everyone's not practicing social distance. No matter how hard you try, people will walk close to you. And if a person were to sneeze or cough in the air and I did not have a face mask on, well then I could easily breathe that in. Will that risk decrease if I have a non-N95 face mask on? The answer is yes. Would it be the best to have an N95 face mask on? The answer is yes. As I said, you cannot control everyone that's around you. You only control yourself. But if I'm wearing a mask like this, although there still can be some respiratory particles that, yes, definitely can get through, that can come in underneath this area right here. But if I'm walking around and I have something covering my mouth and my nose, then I am going to have less of a chance of exposure if someone were to cough or sneeze around me. The second thing is wearing face mask can decrease the likelihood of healthcare providers having availability to face masks. And as you've seen, there are a lot of face masks now being made, such as this one right here, that are made for protection. Now, they don't fit as well oftentimes, but my thought, and again, I'm not the CDC and I'm not the World Health Organization. Right now, the CDC is trying to figure out where they stand on it, and the World Health Organization says if you're asymptomatic, they don't recommend to wear face masks in the public. But my thought about it is I'd much rather have a mask like this if I have to go out into the public and I'm around a person where social distancing cannot be completely trusted because they might walk right in front of you. So I personally feel like these cloth ones are a good idea. You can buy them now on Amazon. A lot of people are selling them, and it's not going to be taking away from those other people the healthcare workers that are needing the masks, because healthcare workers are definitely needing more of the form-fitting masks. The hospital regulations and things like that, they're not going to allow cloth masks in the hospital. Now, the last thing is that wearing a face mask will only increase the risk of getting infected. And there was some small data on that that showed that might be the case. And thus, some people are saying don't wear face masks at all if you're asymptomatic. My thought on that is, if you understand how to use face masks, for me, again, I'm not CDC, I'm not WHO. I'm just telling you all what I feel is the best thing for me and for my family. If you're wearing a face mask, you got to know how to wear it. So, for example, with this face mask, when I place this on, I'm just using it. I'm only holding this area and I'm placing it on here, just like this, okay? And so it's going on like that, all right? Now, I'm not touching the face mask. There are definitely downsides to these types of cloth masks that you can just purchase online. One, they don't form fit really well around the nose. So it's definitely not going to be like an N95, and it won't even be something like this that has more of a form fitting. Also, that they're not disposable. You really can't buy these $5 to $10 on Amazon and then throw it away every single time. So you would need to make sure that every time you go out in a public setting that you wash this, because remember, and I'm going to explain this in a second, but the number one thing that for sure that you need to do, it's all about contact, and contacting surfaces. And so if someone were to cough on this and you were to touch this and then touch your face, obviously you can get infected. And so you would need to make sure that this is well sterilized every single time that you go outside. The next thing I think that's really important to understand is how COVID is transmitted through the air. And so respiratory droplets is when you cough or sneeze and you release, a fluid or particles of the virus that actually then fall down to the ground. And so this virus, look at the World Health Organization and their analysis of this, and of some recent publications where the virus does not float in the air at this point that we see. It's too heavy of a molecule and weighs too much, and then it normally when you cough or sneeze, it's going to fall within 3 feet of the area that you cough and sneeze. You don't want to be fiddling around with a face mask while you're wearing it, because remember, if it's on your hands and you've touched a surface that has COVID on your hands, well, then you don't want to be putting it on the mask. You start putting on your mask, it's just gonna get closer to your face, right? So you want to stop touching your face. Me personally, if I'm not wearing a face mask, just in general, I'm more prone to just naturally touch my face, naturally kind of rub my nose or do something like that. Well, I have less chance of doing those things and touching my face when I know that there's the reminder that I've got this face mask on. I can feel it. It helps me keep my hands away from my face, from my eyes, from surfaces that I have touched, and then can get the virus into myself. So there are some studies in pre-publication right now that are looking at people that are positive with COVID and testing air samples. And the air samples right now are not showing that the living virus is in those air samples. There was a New England Journal of Medicine article that came out that actually had a machine kind of dispersing the virus in the air, and it showed that it could be transmitted over large area. But the problem is it was using a machine, and it was not using a person that was actually coughing or sneezing, which is the reality of this. This is not being dispersed through a machine. So at this point, it looks like it's respiratory droplets. It's not transmitted and just free floating in the air. These respiratory droplets fall to the ground within 1 meter or 3 feet, and that's what we need to be protecting ourselves from. So if I'm wearing this out and I'm at the store, I'm at HEB, and I'm walking down the aisle, and a person decides to turn around because they see some great bargain and they decide to, oh, they're going to sneeze, and they're right in front of me, and they sneeze, and I have this mask on. For me personally, I'm thankful that I had this mask on versus not having a mask, because at least I know I have some protection that that virus did not get into my nasal airway and my oral airway. At that point, though, what would you need to do? Obviously, one, you can't even touch this because it could be contaminated. The second thing is that that you need to make sure that when you go home, how you deal with this surface. So whether or not you saw someone sneeze on you or not sneeze on you, the main thing is when you go home from a public setting and you've been wearing this, is what you do. And so the first thing you would do, you would want to remove it just from this area, the least amount of surface area that you touch. You would want to remove it from here. You would then want to have someone open the door, because you do not want to touch any other surfaces that have been that this has touched. And so there's two options. One, in our home, we have a little, in the garage, we have a little bucket that we put all things in. And so I could put this right into the bucket, and then that bucket could then be dumped into anything that's in that bucket can be dumped into the wash machine. So right after touching this, putting this in the bucket, or if someone already opened up the door for you where you could put it in the wash machine and you haven't touched any other surfaces, then you'd want to wash your hands with soap and water for 20 seconds. And then you can either pick up that bucket that has what could be contaminated and put that bucket into turn the bucket down or around, throw it into the wash machine. But the main thing is limit your contact and your touch, right? The respiratory is definitely a way that it can be transmitted, but by far the main thing is going to be you touching surfaces that other people have touched that have been infected. And if you touch surfaces that other people touch that have been infected, there's a high chance that you are not going to know that those surfaces obviously were infected, otherwise you wouldn't have touched it. And then if you start rubbing your nose, your mouth, or you eat a piece of fruit and you put it in your mouth, and that fruit that you touched then goes into your mouth, that's how you're going to get it. So the number one thing I think is not so much to worry about the respiratory droplets, because that chance is a lot smaller than touching things that people that have been infected have touched. So you should be vigilant about washing your hands and wiping down surfaces and so on. That is the most important thing to do, to stay safe and to continue to not be afraid, but doing things that are going to prevent you from getting COVID. And hopefully this was helpful for those people that had questions about that. All right, you guys have a great day.